Hey everyone, and welcome. Today, we're going to untangle a topic that touches millions of us but is often surrounded by a whole lot of confusion: cognitive disorders. We're going to get really clear on the differences between delirium, dementia, and the one you've probably heard the most about, Alzheimer's. So, let's jump right in.
First things first, let's tackle a question you've probably asked yourself or at least thought about. You see an older family member forgetting things more often, and you start to wonder, hey, is this just what happens when you get older?
The answer to that is a big, emphatic no. And this is so important to get right from the start. Look, some minor senior moments can happen as we age, sure, but major memory loss, the kind that really starts to impact daily life, that is not a normal part of aging. It's usually a sign of an underlying medical condition, what we call a cognitive disorder.
Okay, so here's our game plan. We're going to start with the big picture. What even are cognitive disorders? Then we'll zoom right in on that crucial difference between delirium and dementia. After that, we'll do a deep dive into Alzheimer's, and we'll wrap up by looking at how these conditions are diagnosed and managed.
First up, let's get our terms straight. A great way to think about this is to picture your brain's cognition as its main operating system. A cognitive disorder, then, is like a serious glitch in that system.
So let's be super clear. A cognitive disorder isn't just someone getting old, and it's definitely not a personality quirk. It is a legitimate medical condition where the brain's functions are being affected in an abnormal way. This can be caused by all sorts of things: a disease in the brain, substance abuse, you name it.
And it's a huge misconception that this is all just about memory. It's so much bigger than that. These disorders can hit a whole range of our brain's most important jobs. Things like our ability to pay attention, our judgment, how we plan and organize things, even how we interact with other people.
All right, now we're getting into the absolute heart of our explainer today. Telling the difference between delirium and dementia is one of the most critical things for doctors, nurses, and especially families to be able to do. On the surface, they can look surprisingly similar, but deep down, they are worlds apart.
I love this analogy because it just makes it click. Think of delirium like a sudden, violent thunderstorm. It rolls in fast, it's intense, but then it can pass. Dementia, on the other hand, that's more like the climate slowly changing over a very long time. It's a gradual shift, not a sudden storm.
Let's really drill down into these differences. Look at onset. Delirium is sudden. We're talking hours or days. Dementia is gradual, sometimes over years. And check out consciousness. With delirium, the person is often confused, maybe drifting in and out. With dementia, they're usually alert and clear, especially early on. These are massive clues for getting the diagnosis right.
So, if you only remember one thing from this section, let it be this: delirium is a sudden disturbance, dementia is a gradual decline. That difference in timing is everything. And this is why that distinction is a potential lifesaver. Delirium is very often a treatable medical emergency. It can be triggered by something as common as a urinary tract infection, a bad reaction to a new medicine, or even just severe lack of sleep. Find and fix the cause, and the delirium often goes away completely. Okay, so we've drawn a really clear line between delirium and dementia. Now, let's dive deep into the one that's a household name, the most common type of dementia out there: Alzheimer's disease.
First, it's good to know that dementia is really just an umbrella term for a set of symptoms. Alzheimer's is the big one for sure, but there are many others, like dementia related to Parkinson's disease, for example. Each has its own unique characteristics.
So just how dominant is Alzheimer's? We'll take a look at this. It accounts for about 68%. That's more than 2/3 of all dementia cases. It's huge. So when most people say dementia, they're often, without even realizing it, talking about Alzheimer's.
The scale of this disease is just hard to wrap your head around. Right now, in the United States alone, there are over 5.3 million people living with an Alzheimer's diagnosis. And let me put that in perspective for you. That means 1 out of every 10 Americans over the age of 65 has this disease. It's actually the 6th leading cause of death for older adults in the US. It's everywhere.
So what in the world is going on inside the brain? Well, it's incredibly complex, and scientists are still figuring it all out. But the two main culprits seem to be these things called beta amyloid plaques, which are like sticky gunk that builds up between brain cells, and neurofibrillary tangles, which are twisted proteins that build up inside the cells. Both of these basically choke the life out of brain cells.
So now that we have a better idea of what this is, how do doctors actually diagnose it? And maybe more importantly, what does good care look like for patients and the families who love them?
Well, a diagnosis isn't based on just one thing. Doctors are looking for a pattern.
They sometimes talk about the A's of Alzheimer's. There's aphasia, which is trouble with language, apraxia, which is difficulty with purposeful movements, and agnosia, which is the failure to recognize familiar things or people. All of that is on top of memory loss and problems with things like planning and organizing.
And when it comes to providing care, the priorities are crystal clear. Number one is always to rule out any other immediate, life-threatening problems. From there, it's all about creating a safe, calm, and consistent environment. And please, look at that last point. Support caregivers. This is absolutely essential because this disease doesn't just happen to one person, it happens to a whole family.
Now, we have to be really honest here. As of right now, there's no cure for Alzheimer's. So the goals of treatment are to manage the symptoms, to try and slow down that cognitive decline with medications, and to treat all the other things that can come with it, like depression or anxiety.
Whew. Okay, we have covered a ton of information. So let's take a breath and boil it all down to the most important things you need to walk away with. I think this quote really says it all. These aren't just names in a medical textbook. These are conditions that have a profound, life-altering impact on patients, on their families, and on their caregivers. The only way forward is with comprehensive, compassionate care that supports absolutely everyone involved. And that leaves us with one last thing to think about. Having this knowledge, being able to tell the difference between a sudden delirium and the slow fade of a dementia like Alzheimer's, that's the first step. But the real question is, now what? How do we take this understanding and turn it into better support for the millions of families who are navigating this incredibly difficult journey every single day?